What is dermatology? Dermatology involves the study of the skin, the body's largest organ, which acts as a barrier against environmental factors. Dermatologists are medical doctors who specialize in treating skin-related issues, as well as disorders of the hair and nails. Common skin conditions. Acne, a condition where the hair follicles become clogged with oil and dead skin cells, leading to pimples, blackheads, and cysts. Eczema, a chronic condition characterized by inflamed, itchy, and red skin. Psoriasis, an autoimmune disorder that causes skin cells to multiply rapidly, leading to thick, red, scaly patches. Dermatitis, general inflammation of the skin that can be caused by allergies, irritants, or genetic factors. Skin cancer, the most common type of cancer, which includes basal cell carcinoma, squamous cell carcinoma, and melanoma. Rosacea, a chronic condition causing facial redness and visible blood vessels, often with bumps or pimples. Fungal infections, such as athlete's foot, ringworm, and yeast infections, affecting the skin, nails, and hair. Hair loss, also known as alopecia, which can be caused by genetics, hormonal changes, or other underlying conditions. Treatments in dermatology, topical treatments, creams, ointments, and lotions applied directly to the skin to treat various conditions. Oral medications, pills or tablets used to treat more severe conditions like acne, psoriasis, or fungal infections. Laser therapy, used to treat skin conditions such as scars, wrinkles, and certain types of skin cancer. Cryotherapy, freezing off skin lesions, such as warts, with liquid nitrogen. Surgical procedures, including excisions, biopsies, and Mohs surgery, a precise technique for removing skin cancer. Cosmetic procedures, Botox, fillers, and chemical peels to improve skin appearance. Preventive care, sun protection, using sunscreen, wearing protective clothing, and avoiding peak sun hours to prevent sunburn and reduce the risk of skin cancer. Skin hygiene, regular cleansing and moisturizing to maintain healthy skin. Regular skin checks, monitoring for new or changing moles, and seeking medical advice when necessary. Importance of dermatology. Dermatology is vital not only for treating visible skin issues, but also for managing underlying health conditions that may manifest through the skin. Early diagnosis and treatment of skin conditions can prevent more serious health issues and improve the quality of life.